Today, I want to talk a little bit about osteoporosis treatment and all the controversies. I mean, this is the theme actually of the whole month because a lot of my patients who are teachers, they have time to finally go and have all the preventive things. And I'm reviewing a lot of DEXA scans and RAM results. RAM is the ultrasonic evaluation of bone density and bone quality. And some of my patients, they decided that they're going to talk to endocrinologist about treatment of osteoporosis. And some of my patients decided that they're going to talk to rheumatologist about bone density treatment. And they're coming to me not sleeping the nights because endocrinologist, regardless which specialist you go to, going to tell them, take for the max. Bisphosphonates, medication which was developed 50 years ago when we have no understanding back then of really what bone loss is, that it's inflammatory condition related to your nutrition and lack of exercise. If you go to rheumatologists, they're gonna infuse you with something once a year. Most of it now is monoclonal antibodies. Both of those therapies, they stop your bone from being young and they make your bone age instantly. How they do it? They stop natural remodeling of organic material of the bone. They stop weaving of a collagen into the bone and the proteins entering the bone and stop osteoclasts taking that material out and osteoblasts behind them, rebuilding the bone. And calcium you take, start piling and piling and piling in this bone. And as we know, it's any orthopedic surgeon or oral fascial surgeon nightmare. And how I know that? No implants will be implanted in a lady who took for the max of Bonivo in the past without Mark's protocol. 40 sessions of hyperbaric oxygen, 40 hours of your life in a hyperbaric oxygen chamber. Hyperbaric oxygen is good for you, and I encourage it for general health, but that's how bad that medication affects your healthy tissue, which lost a little bit of density to it and can be completely regenerated with medication or other modalities. So back to what osteoporosis or bone loss is. It's similar to muscle loss. If bone is not exposed to required load and stress, it will start to remodel to be unusable. Send astronaut to the space station, let them return in 1 year. Before they take a first step, did you notice they're always in a gurney being sent to the rehab facility? Because if they take a step, they might break the bone. They need that load, so do you. If your bones start to lose that density, you need to load that bone with necessary stress. If you're a golfer like me, that stress needs to be in the plane of your swing. So in the Lapidus clinic and in Golfness USA, we use multiple modalities to generate that load. From Golf Forever, both directions. So your bones, you build it in your upper body, you build it in your lower body by loading on one side and releasing that load. If you're just a regular person who does a little bit weightlifting, that's great too. But make it meaningful, a little tempo, involve your lower body when you're working on your upper body, your biggest muscle to train. If you only have 5 minutes and you're in a gym and you need to train for 5 minutes is your hip flexors. So bring it up with some resistance. If you're on the bench and sitting there with the exercise ball, just bring it against that resistance. Do squats. That's beautiful. Nutrition. Make sure your gut is healthy. And that's what you think is healthy on your plate. It's actually getting to your bone. Very, very important. Talk to your functional medicine doctor about functional GI test to see, do you have inflammation in the gut? If you have inflammation in the gut, that's it. You're not absorbing your minerals. You're not absorbing your protein. You're not going to build a healthy bone. If you have inflammatory condition in your body, like rheumatoid arthritis, ulcerative colitis, any kind of Hashimoto thyroiditis, that need to be controlled. That need to be controlled for your bone to stay strong. And if your Hashimoto affecting your thyroid and it's a little low, borderline, and you have osteopenia, that low thyroid function need to be balanced to optimal. So your bone actually have that metabolic kick to start building. If you're menopausal, you need to fix your hormones, and not only estrogens. Estrogen is very important and gives you your brain back and your stamina back, but testosterone and testosterone delivery system need to be consistent, not once in a while cream. It needs to be my favorite for reversal of osteoporosis, which we do a lot. We do a lot, and I have the statistic I can show you if you question me. Testosterone pellets is the best modality for osteoporosis reversal when we build healthy bone. If we talk medication, my favorite is anabolic medication, synthetic parathyroid equivalent, which help to kick that bone metabolism. This is the most important hormone, parathyroid hormone, responsible for your bone turnover, getting rid of old materials from the bone, bring that calcium. Vitamin D is not a vitamin, it's actually a hormone. Vitamin D is essential hormone of sending the signal to the bone to start to remodel. And of course, there's always what in general medicine call investigational modalities, but well-researched and well-known. Number one, peptides, which are element of food found actually in studies for astronauts in different countries and given to those astronauts to help to remodel the muscle and the bone, such as BPC 157, TB4, now it's 5,000 fragment, GHKCU, MSF, anything which builds muscle, gonna help to build your bone. Because muscle, through the tendon, pull on this bone and give it that load stimulation. Frequencies, we live in a world of frequencies, and denying that it affects us in any way, it's simply foolish. We live in magnetic fields, we live in an electromagnetic field, we live in a light, we live with some radiation from the sun. All of this is frequencies. So in our clinic, we use frequencies. We use red light therapies, like immersion bed, has a red light and has some vibration and PEMF in that bed, and good for regeneration in general. But if you have osteoporosis, not only is good for healing, it's also good for regeneration of your muscle and the bone. And I'll let you see what else is here available for you when you really need to take a step for better regenerative approach to your bone density. Number one, you can augment your exercise with vibration therapy. Vibration plates. There's so many of them, power plates, millions, different, doesn't matter. A little bit vibration and loading on the muscle on that vibration plate, that will help to augment your exercise. And there's different research from different vendors, all good. Step on any vibration plate is better than nothing. But consult your doctor before you do it, because sometimes hardware on a specific condition of the brain, blood clots, may be contraindication and danger. Other modalities and vitamins and proteins are very important. Mineral complex, not just calcium, but mineral complex, especially before you go exercise, regardless what sport you do. This is your pre-workout. Collagen should be part of your morning routine. Put in your coffee. put it in your morning drink, and it will help to build the organic material of the bone. Vitamin D, I mentioned it already. Vitamin D need to be specific strength for you, need to be measured in optimal level from 50 to 100. My preference, keeping it 70 and above. 5,000, 10,000, very important. What kind of calcium? Not every calcium will be absorbed as well. So the calcium which is recognized by our body as food come from the food. So not from the bricks, not from the shell of crustaceans. It comes mostly from animal sources. So bovine, from bone to bone. There are some arguments on algae calcium. I need probably learn a little bit more, but that's what I know. There was some talk about strontium. It's proven not to be helpful, so don't take strontium, doesn't do anything for your bone. But also look at whole cellular nutrition. We do spectrocell, intracellular, inside of your lymphocytes nutrition, not what's floating in the blood. It needs to get inside of the cell. Vitamin D, hormone, vitamin D, works inside of the cell. If it's just floating in your blood and not there, doesn't matter. Same with vitamin B12. All these doctors in communities, they freak out, tell my patients, oh, your level's too high, stop it. And then we do intracellular vitamin B12 and it's not there. So we need to keep pushing because some of it we're not methylating, meaning we don't have the right ingredients to make it inside of the cell. Look at your genomics. We use genomic tests all the time. Look at your genomics. You might have a higher predisposition for that disease because of specific factors. And their research, which goes very deep in what kind of factors. We're not going to go that deep right now, but in my consultation, I do. So our body is not a different system. We study it in medicine as a different system, but everything is one. Everything is whole. You cannot expect to have disease in one organ and tell that it's not going to affect your bones. Do your frax scan. You don't need to have a DEXA scan to know your risk of major fracture or hip fracture. You can just put your age, your gender, where are you from, are you Caucasian, Asian, are you African American? You put your previous history, any bone fractures, do you smoke, do you drink, how much, do you have rheumatoid arthritis or autoimmune disease? And it will give you a risk. And then you'll have a number. Please don't freak out. If you don't do anything and you're 55 like me, your number will be, you have 1.7 risk for hip fracture. So any healthy 55 years old, go along with their life. In next 10 years, about 2 females like me gonna fracture their hip. I don't have osteoporosis. It's just number per age. And my major risk is about 5. So any bone, shoulder, hip, spine, femur, I might break it if something bad happened. Hopefully not. But this has nothing to do with DEXA. DEXA number is just to get a little bit deeper and see actual structure of the bone, how much of calcium is piled there and how dense it is. It doesn't tell you anything about the quality of your bone. So my patient came, she's being pushed by endocrinologist to take a Fosamax. Her major fracture risk for next 10 years is about 7%. So 100 people, she's maybe in the category of 7, or she may be in category of 93. And knowing my patient who exercise, eat healthy, deal with her autoimmune condition, she will be in category of 93. Does she need to put in her body that harmful medication, or should we work on everything else? Obvious answer, no brainer. So that's my view on osteoporosis treatment. No one pill fit all. No one program fit all. It needs to be you, personalized for you, designed for you, and delivered to you with love. Partner in your health, Dr. Lapidus.